Yay! Hello, 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 hello. Hi. I'm super duper excited for this interview today. I hope you guys are excited too. I'm Yasmin. I was here not last week, the week before last week. Yeah. If you don't know, I am a spiritual advisor. You can find me at Divinely As 2 Y's here on Instagram, and Divinely As 2 Y's on TikTok, Divinely As 2 Y's on Twitter. But yes, y'all are in for a treat today for the interview today. As soon as our interviewee joins, sends a request up, there it goes. Hi.
Hello, hello, hello.
How are you?
I am wonderful. How are you?
I'm doing pretty good today. It's
It's a pleasure to meet you.
a pleasure to meet you too. I'm super excited about today. Looks like some people in here already know who you are, but for the people that don't know who you are, do you mind introducing yourself and telling a little bit about what you do for your work?
Sure, sure. So my name is Zaidi, and I'm a pediatric hematologist. I spent the last several years taking care of sickle cell patients here in Detroit, and have recently transitioned to work on new medications in sickle cell disease, particularly for adult patients. So I'm with a
Mm.
company called Agios Pharmaceuticals these days.
Okay, wow, okay. That's
hmm
quite a transition. Did you enjoy the transition from doing pediatrics to doing what you're doing now?
It's only been a few months, and I love it. I love it
That's
because
good.
there's a real need, right? There's a real need for new therapies in sickle cell disease. So I'm glad that I can still work in the same space and, try to make an impact just in a little bit of a different way.
Right, yeah. And that's actually it's one of the questions that I'm really excited to ask you because a lot of warriors have been very kind of anxious about getting the COVID vaccine because a lot of us are on certain sickle cell medications. But even for the people that are on certain sickle cell medications, they're super duper scared about getting the vaccine, getting
Yeah,
some weird side effect, and then
right.
being sent into a crisis in the hospital. So, from your perspective and viewpoint, what do you have to say in regards to sickle cell warriors getting the COVID vaccine? And should they be worried about getting, side effects that might send them into having a crisis?
So look, we obviously have quite a beast in front of us as far as COVID goes, right?
Yeah.
And all of us have been affected by it. All of us know friends and family that have been devastated by COVID. Now,
Mm.
especially people with a little bit of color in their skin, right? This virus seems to be picking on people of color just a little bit more, and
Yeah.
our communities are hurting because of that. You know, we know what COVID does to sickle cell patients, right? People are following this closely to see what are the effects of actually getting the virus. Is acute chest syndrome more common? Are deaths more common? This research is ongoing, and it seems like similar to what COVID does in the general population, older patients with sickle cell disease, and patients with other problems, kidney problems, liver problems, other things, pulmonary hypertension, lung issues, get sicker. Um, it does seem like there's probably a little bit more death in the sickle cell population compared to the general population. Now, at this point in time, there's no reason, as far as medications that you're already on, that interfere with the vaccine. Okay, so if you're on no sickle cell medication right now that exists is problematic for somebody who wants to get their COVID-19 vaccine.
Okay.
Okay, that's the first thing. The second thing is the medical community has done a lot of bad things to shake people's confidence in what the medical community does. So ask all the questions. Ask every question you have. Be 100% confident as you make this decision, right? that is something that you'll never hear me discourage. I want you guys to ask every question you have to your physician, find the right resources to get those answers, and make a responsible choice.
Okay, I love that. Okay. And I also want to say for the people that are just coming in and viewing, this is Dr. Zaidi that I'm interviewing. And also, if you have any questions, you can leave your questions now. And at the end of this interview, I will go back and review y'all's questions. And I'll answer maybe two. If we have more time, then I'll try to answer more, but at least two.
Yeah.
Dr. Zaidi, I also really wanted to ask you, from your perspective, from what you've seen, if you've seen at all, do you feel like the pandemic has changed in hospital care for people with sickle cell drastically? Like, have you noticed a shift in how they're treated in the hospitals now that the pandemic has been going on?
You know, that's an interesting question. So one of the things I can tell you is that early in the pandemic, people were really cautious with sickle cell patients, like, because they didn't know what was going to happen, right? Like, we were unclear. You know, people thought that, oh my gosh, this is going to be devastating. Thankfully, it hasn't been that, thankfully. Right now, we have a different problem. Right now, the problem is getting care in a setting where the hospital resources are diminishing because they're overwhelmed by people with COVID, right? That's a different ballgame, right? Look, on a regular day, we have trouble making sickle cell patients get the care they need. On a regular day, in a not busy hospital, right? We're fighting to, believe that patients are in pain, believe that they have an issue, like treat them with respect. Now you have all the excuses in the world for why care should get delayed, right? Why hasn't that medication for pain gone into this patient within an hour? Well, it's because the hospital's overwhelmed, right? So care is diminishing across the board because hospitals are overwhelmed. So, that's definitely a trend worth thinking about. And early in the pandemic, I'll tell you, I'd have patients who'd be at pain at home, and they would say, you know what, I don't want to come to the hospital because I'm scared I'm going to get COVID if I come there, right? So that was the problem. And then when patients finally showed up, they were sicker because they had waited longer than they usually would.
I can definitely relate to that on a personal level. I've been hospitalized a few times during this pandemic, and I've definitely been that sickler that was like, oh, I'm just not going to go in the hospital. I'm going to wait.
Right.
And you can't really do that because if it gets too bad, then you're in a more of a sticky situation with being in the hospital longer. Yeah. So I know earlier you said that you really were encouraging people to ask questions with their doctor if they were still a little hesitant about the vaccine. Do you have any resources that you can recommend to the viewers that are watching and will be watching after this live stream is posted? Any websites or people, even yourself?
Yeah. So my favorite, I would never recommend myself so shamelessly, but my favorite resource, honestly, in the sickle cell community is something that I happen to be a part of that I'm super proud of. And the Sickle Cell Disease Association of America has a committee that's called the MARAC Committee, MARAC, and that's Medical and Research Advisory Committee. And this is a group of 34, 35 sickle cell specialists, not just in the US, but from Asia and Europe and Africa. And, it's a global committee that literally meets once every 10 to 14 days and just talks about what we should be putting out there, what message needs to go out, what do sickle cell patients, what knowledge or information do they deserve to have, and what should we chime in on to help guide their decision making. See, in the end, right, a doctor is essentially like a waiter who's taking your order, right? So their job is to show you the menu and tell you what's good and what's bad and what works and what doesn't work, what pairs and doesn't pair. In the end, it's the sickle cell warrior that's got to make a choice on that menu, right? And, I think that finding the people who are able to really go into the details about why things on the menu are better than others, those are the ones you need to find. And there's a lot of those on that committee, right? You may not have one of those in your city where you are, but if you go look at the recommendations from that MERAC committee, you'd be surprised. And there's a lot of experience between the doctors on that committee.
And can more information about them be found on the website?
Yeah, the SCDAA's website has all the information, including who all the doctors are, where they work, and all that.
Okay, good. So y'all heard that. After this live stream, please go check out that website and check that out, and get all the information that you can get out of that website. That's really, really good. I think that's all the questions that I had for you today. Let me see if anybody asked any.
Nice and sweet. I like it.
Yes, I love it. Doesn't look like y'all don't have any questions for Dr. Zaidi? Oh, here's a question. Okay, what if you already have contracted corona? Do you still need the vaccine? I personally contracted it twice, and the last time I did not have any symptoms, many symptoms.
Yeah, so at this point in time, it's still being recommended that you get the vaccine, even if you have contracted the coronavirus. I see the booster question. I was waiting for the booster question. So look, the truth of the matter is that neither the American Society of Hematology nor the MERAC committee have actually come out and recommended the booster for sickle cell disease patients in the moment. Now, there was a meeting about it today, which I missed, but it happened today. This is something that's ongoing and really being thought about, really carefully being thought about. And one of the things I hear from patients is, well, scientists don't really know what they're doing. Doctors don't really know what they're doing because they're changing their recommendations. They tell us one thing on Monday, they tell us something else on Tuesday, right? That's science. That's what science is, right? What you have to be worried about is the people who never change their mind on anything, right? Those are the troublemakers. What science is receiving information, finding new information, and then changing what you think based on that information, right? That's science, right? So recommendations are going to change, and they're going to change continuously. At the moment, boosters are not universally being recommended, but that could change literally as soon as this conversation's done.
Okay. All right. We'll do one more question. If some kids have sickle cell, how should they safely go back to school? That's a good question.
That's a tough question. That's a really tough question. Look, I have a 6-year-old and a 7-year-old. And it was hard. It was a hard decision for me to make, to send them back to school. It's scary to put your child out there, right? Even scarier when they've got sickle cell disease because you don't know what to expect, right? It's scary enough sending a sickle cell child to school without coronavirus, right? Just knowing that they're out there and they're around people who may not understand what they're going through, who may not understand the need for frequent bathroom breaks or why they get tired or why they can't go out in the rain or cold, right? Then you add this COVID thing and it's such an unknown. There's no reason right now that I could tell you to not make your child go to school if you desire them to go to school, right? So I would treat this as a very family and parent level decision. If you feel comfortable in what your school is doing for your child, cool, send them. Let them get the social experience. Talk about the importance of masks. If they're over the age of 12 or 12 and up, get them their vaccine. Just keep an eye out for all of the sort of regular things you would anyway, right? But it's hard to make a recommendation. That's a really personal decision, and you're just going to have to see what works for you and your family.
Okay. Well, that's all the questions that we will be taking today because it's hitting that 15-minute mark. If anybody would like to find you on social media, where can they find you on social media?
You can find me on social media at Dr. Z Sickle Cell.
Okay, that's good. Thank you again for joining me for this interview. This was a very lovely conversation.
Thank you so much for inviting me.
All right, bye. And
before
I go, we'll be coming back here every week like we usually do every Friday doing COVID and sickle cell. I didn't mean to cut you off from what you were saying.
No, I was going to say, I just saw a question about supplements. Get your vitamin D levels up.
Yeah.
We're heading into winter. There's going to be less sun. Get those vitamin D levels way up.
Yeah.
All right.
Okay.
All right. Peace, everyone.
Bye. Y'all can find us again Friday, Eastern Time, 4 p.m., Central Time, 3 p.m. We'll see you again next Friday.
Take care.
Bye.